Hello friends, welcome back to the healthcare today. In continuation to the earlier video where we did a video on viral infections, we are going to cover severe viral infections in this video. Many times you notice that your neighbor or some of your relative had short history of viral fever and you get to know that the patient is on ventilator and in ICU. Why does this happen? When you have viral fever, most of the times when the patient is having immunocompromising conditions, for example diabetes, patients who receive steroids, patients who underwent transplant, patients who had cancers, all these patients have very low immunity in their body. Once your immunity is low, the virus is joined by a bacterial infection, which is a co-infection. It is also called as superadded bacterial infection. When this happens, patient's oxygen demand increases, lung stops functioning. Many times these patients have severe hypoxia. Once they visit the hospital, we get to know that their saturation levels are very low. So when this happens, we usually place these patients on non-invasive ventilation. What happens is, we use a mask. Through a mask, the patient is placed on a ventilator and we give extra oxygen with a pressure support, thereby allowing the closed alveoli inside the lung to open up, thereby decreasing your oxygen requirement. Many times the patient, even after placing on NIV, they don't improve. So in those cases, we put a tube through the mouth, take the patient completely on ventilator. Few patients do improve after intubation. But if the patient, after intubation also the patient is not improving, what will you do? We make the patient lie down on their stomach, which is called prone ventilation. We have done this in COVID. Most of the pulmonologists advised you to do self-proning at home. Similarly, inside the hospital, when the patient oxygen requirement is very high, we ask the patient to lie down on their stomach, or we turn them with the help of our nursing staff and other support. So some patients do improve after proning, but few patients, in spite of doing NIV, in spite of doing intubation, in spite of doing prone ventilation, they don't improve. So what do you do for them? There is an artificial lung mission which is called ECMO mission, extracorporeal membrane oxygenation. This is a mission which is just like a dialysis mission. The blood inside the body, which is having lot of carbon dioxide or very low oxygen, is taken out into the machine and it is put through a small membrane. Through the membrane, once the blood is filtered, we add extra oxygen to the blood and put it back into the lung. So this is called ECMO. Once we place the patient on ECMO, the lung gets adequate rest. So it gets the time for healing. Many times ECMO machine is required for 7 days. Few patients may require for ECMO for longer duration. But once the patient starts improving, the ECMO support is gradually withdrawn, take the patient completely back on ventilator, and gradually the patient is weaned off. So this is what happens once you have a severe viral infection. How do you prevent it? So the easiest way to know whether you are having a severe infection is, as you know that once your viral symptoms start, you need to isolate yourself and also do self-assessment. So maybe a simple walk for 1 minute. So check your pulse oximeter. If your saturation levels are around 97 before the walk, and after doing a slight activity or walking, or even going to washroom and coming back, check your pulse oximeter immediately. Check your saturations. So if it is falling by more than 3 to 4%, that indicates that there is an interstitial pattern involvement. That means you're very soon going to have hypoxic injury. So that is the time you need to consult a doctor. Immediately an X-ray will be done, and the earlier you start your supportive therapy and drug management, the better are the chances you recover. If you delay or neglect it, there is high chances that you will go on ventilator and have severe viral infections. And you all know, after severe viral infections, there will be some sequelae also. Some part of the lung will go into fibrosis. So to prevent all this, please do self-assessment at home. Either a 6-minute walk test or a 2-minute walk test will be adequately guiding you that you are going to have severe infection. Once you are not having those symptoms, please do continue your self-care at home. But once you are having problem, once you are having severe infection, or once you see that there is a desaturation happening after minimal activity, please consult the doctor immediately. That's how you prevent from having severe viral infections. We care about you.